Hello and welcome to another episode of Podcast DX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
And I'm just waking up.
Yes. Collectively, we're the hosts of Podcast DX. On today's show, we are talking about vaccines.
Our featured guest today, although deceased, is considered the father of vaccines. Dr. Maurice Hilleman is considered by many to be the father of modern vaccines. Over the course of his career, he developed many of the vaccines that are routinely recommended for children today. And by the end of his career, Dr. Hilleman had prevented pandemic flu, combined the measles, mumps, rubella vaccine, which is known as MMR. He developed the first vaccine against a type of human cancer, and much more. It is likely that Dr. Hilleman's work has saved more lives worldwide than any other scientist in history.
That's right. And this is our first zombie interview on Podcast DX.
Yes, he is deceased. May he rest in peace. But we are grateful for all his work. And we will be referring to his work along with the current findings from the Centers for Disease Control, the World Health Organization, the European Centre for Disease Control, the Public Health Agency of Canada, the Australian Government Department of Health, the Ministry of Health in New Zealand, and the Voluntary Health Association of India.
And I just want to go back one step and say that the term vaccine comes from the Latin vacca, which is cow. And although we're kind of glossing over Jenner's work, obviously, he had some influence in vaccines as well. And the word vaccine comes from, the vacca and cow, because cowpox and smallpox was what he worked on. Yes. There we go. Interrupting cow. We will only be discussing scientifically tested and proven medical treatments and vaccines. We're not actually going to go into the anti-vaxxer type movement, but if someone would like to come on and talk about that, you can
register for
an interview.
Yep.
And we will listen to that
opposing
argument.
Viewpoint.
Yeah.
I think I'm going to start us off with the biographical information about the father of vaccines. Maurice Ralph Hilleman was born August 30th, 1919, in Miles City, Montana. Maurice's twin sister and mother died soon after his birth. He was raised by his aunt and uncle that lived nearby and had no children of their own. His adopted father, Bob, was more open-minded than Gustav, which was his biological father. Gustav? This likely allowed more room for Maurice's curiosity and intellect to flourish. But he craved the approval of his biological father, and this likely drove Maurice's lifelong goal to succeed. Even as a young boy, Maurice showed a strong aptitude for science. The writings of Charles Darwin were particularly interesting to this future scientist.
And he excelled in school, earning a scholarship to Montana State College, which is now known as Montana State University, back in 1937, where he majored in chemistry and microbiology. He furthered his education at the University of Chicago, where in his doctoral work, he discovered the cause of chlamydia, which is a sexually transmitted disease that had been previously thought to be caused by a virus. And then he discovered the bacterium that was behind the disease, leading the way for antibiotics as a way to treat it. Upon completion of his PhD in 1944, Dr. Hilleman or Hilleman?
We'll do both.
Okay. He started working at a company called E.R. Squibb and Sons, where he developed his first vaccine. The vaccine protected against Japanese encephalitis, which is known as JE virus, which is the most common cause of encephalitis in the world. Infection with JE virus can lead to swelling of the brain and death. The vaccine was used to protect U.S. troops during World War II. In 1949, Dr. Hilleman became the chief of respiratory diseases at the Walter Reed Army Institute of Research in Washington, D.C. His project was to study influenza virus. And during this time, Dr. Hilleman made discoveries critical to our understanding of influenza. First, he observed that the influenza virus underwent changes, and sometimes changes were small, but at other times they could be dramatic. Later, the small changes became known as the antigenic drift, and the sudden major changes became known as the antigenic shift. Antigenic shift can result in pandemics because almost no one in the world is immune to this significantly changed virus, and similar to what we have today.
Yep.
Second, Dr. Hillman realized in 1957 that an influenza pandemic had started in Hong Kong, and he was the first person in history to predict a pandemic. The result was that he created a vaccine before the virus even arrived here in the U.S. Close to 70,000 people did die in the U.S. as a result of the pandemic, but public health officials estimate that the number of deaths here in the U.S. could have reached 1 million had Dr. Hillman's vaccine not been available. And for this effort, he was awarded the Distinguished Service Medal from the American military.
And I think this is interesting that it's all rather contemporary work that was being done. In 1957, Dr. Hillman, or Hellman, I'm not. Okay.
Heilman?
Heilman
or Hillman? Yes.
Heilman. It's okay. Began working for Merck & Co. to oversee their vaccine research and development. And while at Merck, the doctor developed vaccines to protect us from chickenpox, hepatitis A, hepatitis B, pneumococcus, meningiococcus, measles, mumps, and rubella. And that's quite a list. He also was the first person to combine viral vaccines when he created the MMR vaccine, and with one shot, or now it's typically
it's several stages, but
right. Well, I don't believe it's a shot any longer.
Okay.
Children could be protected against 3 diseases: measles, mumps, and rubella. And colleagues note that the doctor was always more concerned with preventing disease than being recognized for his efforts. And many people remain unfamiliar with his name, despite the fact that his work directly impacted the lives of
so many,
yeah. And it's estimated that he saved about 8 million lives, or he saved about 8 million lives a year.
Yeah.
But his work continues to save lives today.
Sure. The first vaccine was done much earlier than Dr. Heilman's, so we should give credit where credit is due. It was the evening of October 12th, 1768.
There was a slight chill in the air.
And
the smell of fall leaves on the breeze.
And Dimsdale was preparing the Empress of Russia, Catherine the Great, for her procedure. From a technical perspective, what he planned was simple, medically sound, and minimally invasive. It required only 2 or 3 small slices into Catherine's arm. Nevertheless, Dimsdale had good reason for his concern, because into those slices he would grind a few scabby pustules teeming with variola, the virus responsible for smallpox, and the death of nearly a third of those who contracted it. Though he infected Catherine at her behest, Dimsdale was so concerned about the outcome that he secretly arranged for a stagecoach to rush him out of St. Petersburg should his procedure go awry. 28 years later, Edward Jenner improved this proto-vaccination when he discovered that he could use a safer, sister virus of variola called cowpox, like Jean was talking about earlier, to inoculate his patients. But it's the original variolation, not Jenner's vaccine, that first established the efficacy of the crazy and at the time ludicrous, dangerous idea upon which nearly all vaccines rely: the intentional infection of a healthy person with a weakened pathogen to bequeath immunity.
Or bequeath.
Oh, for crying out loud. Am I going to keep repeating this?
I'm sorry. We all need about a pot of coffee.
Okay. That's all right, Jack. You can leave that in there.
Okay.
And where did you get this information from?
Oh, I'm sorry. I got this from Wired.com on who discovered the first vaccine.
And I think, we have to give some credit also where credit is due to the women who were milking the cows and would get cowpox, and then people realized that they didn't get smallpox because they were immune to it. And Jenner had heard about this, and that's what he based his experimentation on. And he, what he did at that time would not be considered at all ethical at this time, where he gave the first vaccine to a small child and then went and exposed him to smallpox.
Oh.
Yeah.
Okay.
That's probably why you got that stagecoach ready when we're talking
No,
about
this was a different dude. Yeah,
that wasn't Dinsdale, that was Jenner.
This was Jenner.
But they're all kind of taking some
they were all
big
taking risks back
yeah.
there.
Oh, yeah.
And the cows. Let's give credit to the cows.
Let's give credit to the cows. Poor cows with cowpox.
Okay, so it's a pretty interesting history about vaccines, but let's now talk about what vaccines are used for today in light of the fact that we are actually in the middle of a pandemic.
Oh,
Sure.
Excellent idea. There are actually quite a few, right? Let's start at birth. Jean?
Okay. Well, I'm going to start by saying that there are 4 or 5, depending on your perspective, types of vaccines. There's a live or attenuated vaccine like MMR.
This is where Jean goes off script.
I'm sorry. So that one is if you are immunocompromised, or you've had an organ transplant, you have some other reason why your immune system is compromised, you need to be cautious if you or a family member is receiving an attenuated vaccine, because it's sloughed off, including in your bowel movement. So you need to, your doctor, should be aware that you have an immunocompromised system, and you should need to be cautious with that one. And then there's biosynthetic. For example, hepatitis B is a biosynthetic vaccine, so it's created in a laboratory. There's the killed or inactivated, which has, you don't have to be as concerned if you're immunocompromised. So there are different types. So the RV vaccine protects against rotavirus, which can cause severe diarrhea. The DTaP protects against diphtheria, pertussis, which is whooping cough, and tetanus. Oh, and then there's also the vaccinations against toxins, where you receive, so that if, for example, tetanus is one.
Okay.
There's the meningitis vaccine, the PCV3, which protects against pneumococcus, and that can be cause blood infections or meningitis, and often you get that before college. The IPV, which protects against polio, MMR, which protects against measles, mumps, and rubella, and typically that's a liquid that's inserted into the nose. There's Hep A and Hep B, which protect against liver infections, hepatitis, and there's the varicella, which protects against chickenpox.
And those are the typical vaccines that are administered in a single, double, or triple dose between 1 and 18 months.
Correct. And then we can add to that the flu vaccination, which is given yearly, and they try to make a logical estimation of which variation, as Ron was talking about, the flu vaccine, the flu influenza can shift, so they need to make an educated guess as to which virus is going to be most likely to occur in the population.
Exactly. And this is the year we must all get vaccinated from the flu, since right now hospitals and doctors are already being overworked with COVID. And then there's a slew of vaccines that are required in order to travel to some other countries, and you can find the list based on the country you are visiting on the CDC website.
That's right. And there are some people that don't trust vaccines.
Sure. If you have a child that has a condition, you want to know the root cause of that. And some parents avoid vaccinating their children because of a misplaced fear, for example, of the measles, mumps, and rubella vaccination, because they're concerned that it could lead to autism. But it's far more likely to lead to, more potential deaths and outbreaks, because we're not, it was almost eliminated and now it's coming back. So there have been many independent scientific studies that have repeatedly demonstrated that there's no link. And the most recent study actually evaluated 657,000 children in Denmark.
And it showed that the MMR did not cause autism.
And it is important, though, if you're immunocompromised, that you take steps not to have complications while your child is undergoing that course of vaccination.
Right. Well, actually, the newest vaccine is for COVID, which should be out shortly. And right now, there are at least 2 companies here in the U.S. that have developed one that, from the latest, I heard was not 80, but like 90 to 95% effective.
Correct.
And hopefully we should start getting that in the next 1 to 3 months.
Right, that's right, Ron. And they're currently determining like the logistics of that and how they will deploy the vaccine and who will be the first to get vaccinated. There is a slight concern. Anytime you have a virus, a bacterial infection, and a car accident, surgery, or sometimes a vaccination, there's a very, very, very low risk, but potential risk that you'll develop Guillain-Barré syndrome, which is an autoimmune neurological disorder. So your body sees those, sees brain cells and neurons and neurological cells as the enemy or the virus, and starts to attack your own. You attack your own system. So there was one person in the UK that developed it with the vaccine, but
that was a overseas vaccine.
It was, and it's extraordinarily rare, and they don't even know if it was the vaccine or something else. So, there's there have been a number of patients who actually got COVID and developed it. So, I think it's
Okay.
Okay, but they're currently trying to figure out how to deploy the vaccine so that everyone can be safe.
Well, the current train of thought is that first responders like doctors, nurses, paramedics, and the like will be among the first group to get vaccinated, but no actual decision has been made yet, or at least it hasn't been announced yet. One of the 2 vaccines has to be kept colder than Antarctica before use. So the rollout for that one will be tricky due to the extremely cold temperatures that it is stable at.
Right, and I think we've covered the history of vaccines pretty well. If our listeners have any questions or comments related to today's show, they can contact us at podcastdx@yahoo.com, through our website, podcastdx.com, on Facebook, Twitter, Pinterest, or Instagram.
And I think maybe we ought to get a stagecoach ready to flee just in case.
Sure, yep. Mm-hmm.
And if you have a moment spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions that you may have regarding a medical condition or treatment, or before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking it because of something that you've heard on this podcast.
And as a last reminder or suggestion or request, at the holidays, typically in the U.S., we are seeing fewer blood donations. And during COVID, we are seeing even fewer blood donations. We are almost at a critical need for blood for surgeries, sickle cell, and other...
Guillain-Barré.
Yeah, so please, if you're medically able to, take a trip to your nearest hospital or blood donation center and give a pint and call it your Christmas gift or your holiday gift or your whatever gift to the world for this season. And until next week, we're out.